In IVF, usually we do egg pickup transvaginally. In whom do we do egg pickup transabdominally? So let's discuss regarding this. Hi, I am Dr. Madhuri, fertility specialist. So transabdominal oocyte retrieval is usually done when the ovaries are inaccessible transvaginally. So when the scan is done vaginally, the ovaries are not visualized clearly, but when the scan is done transabdominally, the ovaries are visualized clearly. Next indication is fertility preservation. So in young women who are virgins, so when they have been diagnosed with a decreased ovarian reserve or when they are diagnosed with any cancer, so they will be suggested fertility preservation. So in these, we usually prefer a transabdominal oocyte retrieval. Also, as a part of some cancer treatments, when the ovaries are transposed to some other location to facilitate giving radiotherapy or some other treatments. So in these, the ovaries would be accessible transabdominally better. Also, when there is a multiple large fibroid uterus and this is occupying most of the pelvic cavity, the ovaries would be inaccessible transvaginally and a transabdominal oocyte retrieval will be technically feasible. And in case of big endometriomas also, when we do the retrieval transvaginally, if we need to pass the needle through the endometrioma, there could be a risk of infection. So usually we avoid in that cases and we prefer a transabdominal oocyte retrieval. And also in some cancer patients like in cervical carcinoma patients with vaginal involvement, we prefer a transabdominal oocyte retrieval. In women with previous history of pelvic surgeries, the ovaries may be displaced. So in these women also the ovaries will be accessible more transabdominally. Also in patients with Mullerian agenesis. So in what is Mullerian agenesis? In these women, due to the genetic condition, the uterus will be absent. There will be a short blind vagina, but the ovaries will be present. So as the vagina is short, so the ovaries will be more accessible transabdominally. In these patients also, a transabdominal oocyte retrieval is preferred. Thank you.